Hello. Hi, everyone. Thank you all for joining today for CareScout's 2025 Cost of Care Survey webinar. And believe it or not, we've been doing this survey for over 20 years, and today is the first time we're bringing everyone together to showcase our results. My name is Marlena Del Hierro, and I have been a trained gerontologist for over 10 years and an operations leader here at CareScout. I am honored to moderate today's briefing. We are joined by our primary architects of this year's survey and policy analysis. To give you a little background on our experts today and our speakers, we have Jackie Alcott, who is our Senior Director of Data Insights and Strategy and has led the rigorous data collection process for this year's survey, overseeing outreach to over 200,000 providers to ensure the benchmarks we discussed today are the most defensible in the industry. Then we'll hear from Michael Shepard, who is our Vice President of Legal and Government Relations and brings a critical policy lens to our data. He will help us bridge the gap between these raw market numbers and the shifting regulatory environment that is redefining how we build and fund aging services. So our goal today is to bring together these different verticals, looking at the clinical, data, and policy to provide you with a comprehensive source of truth regarding the cost of care in 2025. So we have a pretty jam-packed 45-minute presentation followed by a wrap-up. So if we have time, we would love to hear from you, hear what your questions are. So please use the Q&A box at the bottom of the screen for any questions, and we'll keep track of them. And as time permits, we'll answer as many as we can. And then, also, no need to screenshot any of the slides. We'll be sharing to anyone who registered, we'll be sharing an email after this that showcases resources, this deck, as well as our iframe tool, which I'll share at the end of this presentation what that actually is. A quick review of our agenda. We're going to look at the methodology. So Jackie will talk a little bit about how we compile this data. There's going to be some similar studies in the market. So we want to take some time to talk through what survey the primary source of truth for the industry. Then we'll look at our 2025 reveal. We'll take a deep dive into the national medium results by care segment and the notable trends we're seeing this year. We'll also look at the regional landscape. So we'll take a look at the national heat map to identify cost outliers and regional variances. We'll also hear from Michael Shepard on policy and challenges. So he'll bridge the gap between our data and the impact we see beyond our four doors. He'll review some of the innovative policy solutions. And lastly, we'll have drivers and wrap up. So we'll be closing with primary societal and economic factors, driving these shifts and introduce tools to help you put this data to work. But first, before we get to Jackie and before we get to Michael, let's talk about why we're here today and why CareScout has been committed to conducting this massive survey for more than 20 years. So I think many of you here you want to learn more about what this data means. We're not just collecting numbers to collect the numbers. It's because we're facing a demographic and economic imperative that impacts every industry and every family in this country. So looking at the demographic shift right now, 10,000 Americans are turning 65 every single day. And this isn't a temporary shift. This is a total shift in our national landscape. And studies show that 70% of adults over 65 will need some form of long-term care in their lifetime. So you're looking at this large group of aging Americans with those with 65 and older needing care. And this really does create an affordable crisis. So nursing home is currently financially out of reach for 90% of Americans aged 65 and older. And when a cost of a private room exceeds $129,000 a year, the planning gap for the average American becomes just out of mind. It's a very hard thing to really fathom. And then beyond the professional care settings, there's a massive hidden care economy, also known as unpaid caregivers. Unpaid caregivers provide approximately $875 billion in services each year. This is 25% of our population managing work and caregiving at the same time, also known as the caregiver sandwich generation. And with that, we have profound impact on national productivity and mental health. And this is why we're behind today's briefing. We want to provide a source of truth that brings together the many verticals needed to address this crisis. So from finance to law to healthcare and to even real estate. Our goal is to give families and professionals the clarity they need to see their full landscape before they're forced to make decisions under extreme pressure. So with that, we are very excited to share CareScout's 2025 Cost of Care Survey results. Take it away, Jackie.
Thank you, Marlena, and thank you to all of you who are attending today. Before we get into the numbers, we wanted to spend a little time talking about the methodology and the rigor and history behind the numbers that you're going to see today. In addition to completing the survey for over 20 years, our team works very hard each year. This year, we collected over 16,000 surveys, which equated to over 25,000 different rates. This isn't a small sample size. We work to collect data at a metropolitan statistical area, or we refer to it as an MSA level, which really focuses on getting enough population within multiple zip codes to have relevant information. This equates to us being able to provide over 434 unique regions across every state, including the District of Columbia. We also collect these rates between a specific time frame each year. That time frame for us is between July and November, ensuring that the findings we are sharing with you today are current and also reflect the actual market realities that families and professionals are navigating right now. We do partner with a third-party market research firm. They contact the care providers on our behalf and conduct the surveys. Each year, we collect a master list of providers. We curate that from Dun & Bradstreet. It's also supplemented with over 100,000 unique providers that Genworth has experience working with. And we aim to get 10 providers in each MSA per care situs. It's important for us to get responses across all MSAs and not focus on specific large areas. Not all providers respond to our requests. As you can see here, outreach of over 200,000 is what it took to get 16,000 providers to complete the survey. We do reach out multiple times. In most cases, we'll reach out 8 times before we strike that provider off the list and move on to another. All rates shown in the survey are based on median calculation. Why do we choose median? Well, median is really the metric that helps insulate against outliers or skewed data, which we typically see in survey responses. What truly sets this survey apart is that it's built on direct provider outreach. We talk to each provider. Similar reports you may see in the market could be based on information that a company's collected through their provider network or based on consumer memory. In talking directly to our providers, we specifically work to understand the type of care they provide. We clarify definitions with them. We understand their licensure requirements. And we also ask secondary questions to understand drivers and pricing models, which we're going to share with you some today. Why does this matter? This matters because better planning starts with better data, and CareScout continues to make reliable data accessible to everyone. All right, we'll move on to results. The overarching theme this year for us is really meaningful moderation. For those of you that have seen the survey over the last few years, there were very distinct post-pandemic spikes. And this year, we're seeing year-over-year growth rates between 1% and 5% across most care settings. In-home care, you'll see here we reported a 3% increase for non-medical care, an increase to $35 per hour versus $34. You'll also notice that we've streamlined our reporting this year. After multiple years of monitoring both home health aide and homemaker, we were seeing a trend towards agencies no longer differentiating cost for those two care delivery types. This year, 86% of the agencies that we surveyed are now charging the exact same rate, combining the activities formally for both home health aide and homemaker choremaker. For the first time this year, we have reported skilled nursing in the home, also known as private duty nursing. As we have seen over the last few years, more skilled care in the home is becoming available. This year, we reported a median hourly rate of $90 and a per visit charge of $160. This typically reflects brief task-based clinical needs, things like medication, IV medication, and wound care. For assisted living, we saw a 5% increase to a national median of $6,200 per month. While this is still a rise, it's a significant decrease from the double-digit growth that we saw in 2024. The intriguing result this year for us is adult day, which you'll see here actually shows a decline of 5% to $95 a day. For us, we're not saying that this is an actual decrease. We're actually seeing this more as a neutral change year over year. Our research, as we will share later, shows that this care delivery type is heavily influenced by state Medicaid reimbursement benchmarks. And after several catch-up years, we saw those adjustments constrained or reduced in 2025, which is reflected in what we've seen in our results. Following similar suit, nursing homes saw modest growth between 1% and 2%, depending on private and semi-private, which also aligns with inflation. The fact is that while we saw meaningful moderation in the increases, cost still remains historically high. Moderation does not equal affordability. So one of the things that we also ask from our survey participants is, what do they see as the key drivers of the increase in cost year over year? This year, we see three primary engines driving the cost. First is really location. Just like any other real estate or service market, where you live matters. Local land values, the cost of living in a specific city, and even state-specific regulations create huge variations in what families might pay from one zip code to another. Second is inflation and rent. It's not just the roof over their heads, but providers face the rising costs of utilities, property taxes, and the insurance required to run their facilities and agencies. As it gets more expensive to maintain safe and modern buildings, those overhead costs naturally push the price of care upward. Last, and really the biggest piece, is labor cost. To provide high quality care, facilities and agencies have to compete for what we see as a shrinking pool of workers. To recruit and keep good people, they've had to raise wages and improve benefits, and those increased payroll costs are reflected in the final rates. Additionally, staff to participant ratios can also drive cost, depending on one-on-one, which typically happens in a home care setting, or one-to-many, which can happen more in a facility setting. Eyes-on supervision required for cognitive needs can also increase care costs. Operational capacity. Unlike a 24/7 facility, adult day centers rely on high daily attendance to cover fixed overhead. When they operate at full capacity, they can often keep their daily rates lower for families. All right, go to the next slide. This is really a heat map trend. So of the values that you saw on the previous page, this is really set by large segments of the country. One of the most frequent questions we get is, why is care so expensive in my specific city? Our data shows that geography is one of the most significant factors in care pricing. If we look at this heat map, you can see that the divergence is clear. Higher cost in the Northeast, higher cost as you go out to Midwest, lower cost in the South. The other things we see when we dive in at an MSA level is really metro versus rural impacts. However, they're not the same across all care situs. For example, assisted living. The correlation to a local housing market is undeniable. Room and board rates in major metropolitan areas are consistently higher, often exceeding rural medians by 15%. Conversely, home care can be more expensive in a rural area due to travel needs for staff or really staff availability. While we see meaningful moderation nationally, some regions still feel the squeeze of high labor competition. Our results are based on survey respondents. While we work to ensure the quality, we want to make sure that folks use this as a benchmark, as well as taking the opportunity to understand and vet additional care in your area. For professionals in the room, attorneys and wealth managers, MSA level data is really critical. You can't just look at a national average to build a client's estate plan if they live in a high-cost outlier hub. Considering where they are now and where they plan to retire or receive care in the future could significantly make a difference in what they're planning for their future care costs. All right. For the next few pages, we're actually going to dive into home care, ALC, nursing home, and adult day. We're going to share correlations that the research team has really been monitoring over the last few years, as well as insights that we gather from all of our providers. On each page to the left, you're going to see a heat map. The lighter the purple, the lower the cost. The darker the purple, the higher the cost. Similarly, on the right side, you're going to see correlations to cost trends that we have seen in outside resources beyond the survey. So for home care, from a regional perspective, as we talked about on the last page, we do see higher cost in the Northeast and higher costs as you get to the mountain region, as well as the West Coast, and our lower costs isolated in the Southeast. On the right side, the red line is the cost of care survey, and the green line is from the Bureau of Labor and Statistics. What we have seen and heard from our providers is that wage is really the main driver of in-home care. We are seeing that those are trending and moving similar with labor market trends, and this is connected to what we hear. From an assisted living standpoint, very similar to what you saw on the heat map previously. And then one of the correlations that we've been monitoring is really from the housing and urban development. So what do we see in HUD as the cost of room and board and rent in a location? We are seeing a nearly identical correlation between assisted living community monthly cost and what HUD reports for a one-bedroom apartment. Assisted living costs increased 5% in 2025, while HUD rental data for the same period increased 4.8%, almost identical. This demonstrates that ALC pricing is not driven only by care costs, but also room and board. When we talk to our ALCs, one of the things that we also ask is the type of facility that they are. And we also work to understand how they bill and what their pricing structures are. One of the things that we gathered this year showed that 40% of the ALCs are now continuing care retirement communities, or CCRCs. Many of these require an entrance fee. Therefore, entering a CCRC can have a higher cost up front, but discount in the future. CCRCs allows residents to age in place, allowing graduating care from independent living, assisted living, all the way up through memory and dementia care. The other interesting fact is not all ALCs actually have memory and dementia care units. This is something else that's also really important when you're planning where you're going to be receiving care from. Will they be able to support if you have cognitive concerns or issues? 58% of the ALCs we surveyed say they have a memory or dementia care unit. Pricing structures are also not the same. This can actually make it very hard on families and customers who are trying to compare one assisted living facility to another. What we've seen in our survey is that there are 3 types of pricing structures. A tiered pricing structure that charges for different levels of care that can be increasing. 46% of our respondents say they charge a tiered pricing. There's an all-inclusive rate, which includes all care and all charges. 38% price under that model, and 16% price as a fee for service. Fee for service can be very different month per month depending on the services that are needed, and also may not help plan what to expect from a billed perspective each month. Nursing home. This graph here that we're showing on the right really shows a slowed growth year over year, and it shows it stabilizing more with the Medicare rate reimbursement. While nursing home rates remain historically high, the growth has moderated to 1% to 2% annually. This modest increase reflects ongoing inflation and staffing pressures in the high acuity environments without the volatility of some market distortions we saw in prior years. Almost all nursing homes are licensed by the state and are Medicare or Medicaid certified. We also see that there is a high demand for nursing home. 83% told us that they have 83% is the average occupancy rate, and 1/3 indicated that they actually have a waiting list to go into their skilled care nursing care. The other interesting information is that only 1/3 of nursing homes have a memory or dementia care unit. That means that the majority of that care is being delivered in the ALC environment. Adult day. Year over year, we reported that we saw the decrease of 5%, as you can see on the red line on the right graph. As we also stated, this is likely not a decrease, but more of a reflection of stabilization. It's also hard to quantify the number of adult day centers across the nation. A lot of these are community-based and very local in nature. 46% of the adult days that we talked to said that they were for-profit, and 54% identified as not-profit. We've also learned that the customer base is dominated by Medicaid-paying customers, with only a small percentage being private pay. We believe the rates are heavily influenced by Medicaid reimbursement rates, and they serve as the benchmark in many markets. As you can see on our graph, since Medicaid is state-specific, we've included a few states and also indicated how that has changed over the last few years. You'll see some have not increased their rates in the last 5 years. Adult day remains one of the most affordable care options, while additionally providing supervision, engagement, and structured daytime support. From 2020 to 2024, Medicaid allowed price increases in most states to essentially allow the industry to catch up to inflationary adjustments. In 2025, many locations saw no increase in Medicaid price. With the value prop of structured daytime support, social engagement, caregiver respite, and the potential to delay higher acuity placement or moving into a facility, in my opinion, adult day services remain one of the most practical and often overlooked tools that families have. So all in all, the 2025 findings suggest that while the rapid cost acceleration that we saw in recent years has eased, the baseline cost of long-term care remains historically high. This just continues to reinforce the importance of early planning and informed decision-making. The reality is that long-term care remains one of the most significant financial challenges that individuals and their families face as they age, and planning matters. Understanding care costs and how they evolve over time enables individuals to explore funding options earlier and make more informed decisions about the future. And this is why we continue to complete and share the results of our survey every year with all of you. I'll pass it back to you, Marlena.
Thank you. A really incredible of how our data comes together and why it just stands apart as such a reliable benchmark for this industry. Now, to connect those findings to the broader landscape, I'll turn it over to Michael Shepard, who will explore how these insights intersect with policy trends and real-world challenges we're facing across the field.
Thank you very much, Marlena. So the numbers that Jackie shared with you bear out the reality that we're at a critical time. I'm sure that many of you on this webinar have your own personal experiences. I certainly do. I have a mother who's almost 86 years old, so we're all familiar with the struggles and the issues we're dealing with now. And you see it reported in the headlines, increasingly so, as reflected on this page. Marlena spoke about how many baby boomers are turning 65 every day through 2030, and that a sizable majority of them will need long-term care during their lifetime. And the sad thing is that the overwhelming majority of them won't be in a financial position to do so. The fact is that the cost of care is high and it's rising. And we're not talking about short-term expenses. We're not talking about a day, a week, a month. The average long-term care event lasts 2 to 3 years. So these aren't just numbers on a spreadsheet. This is not theory. This is real life. These numbers shape household budgets. They affect retirement savings. And very unfortunately, they force families into difficult choices at perhaps the worst possible time. So how does one go about financing long-term care? There are three main options. One is you could self-fund. I mean, you could. It's very expensive, so there are a few people who choose that route. There's private insurance, and there's Medicaid. In fact, Medicaid's the primary payer of long-term care in the United States. Um, but that places a tremendous amount of pressure on both state and federal budgets. And that pressure is only going to increase as the population ages. And the demand for care will increase as a result. Uh, Medicaid was never designed to take on the role that it's taken on. It was never designed to be the backbone of the long-term care financing system. And many of you know its limitations. A lot of people have to spend down their assets in order to qualify. And as due in part to the One Big Beautiful Bill Act, eligibility rules are tightening and federal support is decreasing. But there's hope. Conversations are happening in Congress and at the state level about how we could rethink how we pay for long-term care. So at the federal level, there's the WISH Act. The WISH Act, what is it? It is a bill. It was first introduced by Congressman Tom Suozzi from New York back in 2021. It didn't gain much traction at that time. He reintroduced it last year, and it would provide a layer of support for long-term care costs. He has been successful in getting a few co-sponsors for the bill, including John Molinar from Michigan, a Republican, importantly on the other side of the aisle. So just in summary, what would it do? It would provide a monthly cash benefit, and it would involve a vesting requirement, as well as as it's currently drafted, a 1 to 5 year waiting period. Although that's under discussion, I'll talk about how it's actually being revised later on. And that waiting period would depend on one's income level. So folks will be responsible for covering their own costs during the waiting period. And the triggers for coverage would be consistent with what you see in many long-term care policies, and that is help with 2 of the 6 activities of daily living or severe cognitive impairment. And once someone's eligible, they'll receive that monthly benefit for as long as their need for care continues. So it's a fairly modest amount. Based on the 2021 version of the bill, it would have been around $56,000 capped a year. But it helps defray the costs, and it could meaningfully reduce the burden for families, especially in prolonged care situations. A couple of things to note about the WISH Act is, and I alluded to this earlier, it does not envision the government acting alone. It contemplates a role for private insurance, especially to help families cover the cost of long-term care during that waiting period I mentioned. And then another important element is the emphasis on education. You heard Jackie talk about the need to plan early, and that is, frankly, a lot of folks are not as aware as they might be about what options exist for long-term care. For example, many folks are under the mistaken impression that Medicare will cover their long-term care expenses, and that's largely not true. But many people think that they'll be covered through Medicare. So the important elements of the education campaign, it would include an education on what actually long-term care is, what's your likelihood of needing it during your lifetime, what government programs cover and what they don't cover, perhaps more importantly, and then what options exist to help you plan for the cost of care. So as I mentioned before, the current proposal is still being refined, revised. There are a lot of questions yet to be answered, and perhaps most importantly is how to fund it. I mentioned that the 2021 version of the bill contemplated a payroll tax. That funding mechanism was removed from this version of the bill, but it's perhaps obviously a very, very key issue in getting the bill passed. So that is at the federal on the at the state level. There are lots of conversations that are happening. We're heartened by that, and in fact, a few of the states have either implemented or actually taken steps to create a state-run long-term care financing program. Washington State was the first to actually implement such a program, and that is known as WACARES. So the WACARES operates a little bit differently than the WISH Act. The WISH Act focuses on catastrophic coverage, whereas WACARES takes on the front end layer of protection. Again, it's somewhat of a modest benefit. It would be a lifetime benefit of $36,500, and it's funded through a 0.58% payroll tax. And that is currently in effect now. The triggers for coverage are assistance with 3 activities of daily living or instrumental activities of daily living. And it's generally mandatory, but there are a few groups who are exempt, including federal employees, retirees, self-employed people who choose not to opt into the program. And the folks who actually don't receive benefits don't have to contribute to it. And then just last year, Washington took an additional step, and they enacted legislation to create a supplemental long-term care insurance program, and that's designed to encourage the sale of private insurance product that would complement the WACARES benefit. So the creation of this program is an explicit recognition that the private sector needs to be a part of any sustainable long-term care financing system. Other activity this legislative session in states, Connecticut, Hawaii, Illinois, New Jersey, and West Virginia have all introduced bills to either establish state-run long-term care programs or to formally study the state's needs around long-term care. So again, we're heartened that there's increasing recognition about this issue that, frankly, is a crisis now for the United States. So that's all about financing in terms of proposals, but a comprehensive solution needs to address other items, including paths to quality care, better planning tools, support for caregivers. So for the next few minutes, I just want to focus on the direct care workforce. So we've noted in the cost of care survey that workforce issues have a big impact on the broader health of the long-term care ecosystem. When the workforce is strained, the entire system feels it. It's families, providers, everyone in the system. Direct care worker shortages, they're not new to long-term care, but the pandemic had a huge impact, especially on recruiting and retention of workers. And these shortages have real consequences. So providers, for example, struggle to offer and maintain the level of care that families have come to expect and frankly that they deserve out of a long-term care system. So specifically in some communities, staffing shortages mean longer wait times for home care, limited service offerings, and others facilities have closed altogether. So something needs to be done about this, and we know that with the increasing demographic pressures, we're going to need to continue to cultivate workers in a variety of sectors, but very importantly in the long-term care aging services space. But there are opportunities. There are opportunities to improve education and training, opportunities to strengthen recruitment and retention, and to increase wages. So we could do nothing, but if we were to do that, the demand for care would continue to rise based on the demographic pressures we talked about earlier, and the workforce would fall further behind. I'm certainly not suggesting that we take that approach. If we did that, the family caregivers would feel the squeeze, especially for folks who are trying to take on caregiving duties as well as go to work, take care of their kids and their aging parents. We refer to that as the sandwich or the panini generation. If we want these programs to succeed, these reforms to succeed, we need to pair them with a serious commitment to the people who deliver the care every day. Without paid caregivers, frankly, there's no system. And we know that then the burden will just fall on families, where it is, there's too much burden on families as it exists today, as the system exists today. But again, like I said, there's some momentum around reforms in various areas, including in this area. There have been a few congressional proposals. There were a few that were proposed last legislative session. A couple of this session. I'll just mention one for illustrative purposes, and that's the Caring for Seniors Act. And luckily that was a bipartisan proposal, and it would fund training and education to help expand the direct care workforce. And then it would also give a modest benefit for low-income seniors to help with their assisted living expenses. So, like I said, there's a lot of activity. There is at least the expression of a growing appreciation for where we find ourselves, and we're hopeful that action will be taken on at least a few of these measures. With that, I will hand it back to Marlena.
Thank you, Michael. And just so you know, Michael, I'm going to be walking around the office today just saying there's hope, because that felt good. That felt good. So I really appreciate that. And I think like these policy updates, it's pretty clear that we're at this massive turning point. But also we've got data showing the increase in costs are finally cooling a bit. But then we look at the sandwich generation. People squeeze between children and aging parents and realize that cooling doesn't mean affordable. So we've covered a lot of ground from the WISH Act, the reality of caregiver shortage, but I want to also just save some time for y'all around what's on your mind. So I think we have some time to take a few minutes for questions. So let's see what came in. Quite the chatty bunch. So this question is for Jackie. Adult day health seems more cost efficient than home care. So why isn't it more popular? Is it because centers are closing or because families don't know they exist?
Oh, that's a very good question. And I appreciate the person who asked that. And maybe they heard the passion as I was going over the adult day page. I think it's probably a couple things. I think it's probably a supply side issue, so availability of it. And then I also think there's a marketing challenge. I think that since it's dominated by the Medicaid reimbursement rates, I think it's hard for centers to maintain staff, be competitive for wages. And I think many providers have to leave the market because of that. But I also think there's a large awareness gap. I don't think families are always aware of it as an option. I think, unfortunately, it can also have a stigma associated with it, as if it's a daycare center versus all of the support and help that it can provide. And I also think because there's low private payers attending, I don't think there's a lot of public pressure to really support or fix or help that care delivery grow across the nation. So I think that it's probably a combination of things, and I'd really like to see how Adult Day can partner more with other local resources. So how home health can support Adult Day and vice versa, because I think that there's coordination of care that could really happen and support the aging population. Yeah.
Thanks, Jackie. We have, this next question is for Michael. You talked about the WISH Act and the WA Cares Fund. How much momentum is there for other states to adopt these types of insurance models in the near future?
Yeah, I appreciate that question. It's I wish there were a definitive answer to that. But as you know, it's really, really tough to predict, whether actually a proposal will actually be implemented and certainly when it might be implemented. As I said before, I'm very happy that there is based on the increased activity we're seeing at the state level, that the momentum we're seeing with the WISH Act having been reintroduced. I'm happy that there's recognition that the current system is unsustainable. And as you talked about, 70% of people over 65 will eventually need long-term care. I talked about them not being financially prepared. So, like I said, there's momentum with the WISH Act and the states, but big changes like this require time in any event. But here's what I can tell you, and this, that we as an organization feel very strongly that this is an important issue, and we're very involved with the WISH Act. We've been involved with other state initiatives, so we will definitely show up and support these meaningful reforms.
Thank you, Michael. And don't go away, Michael, because actually I have the next ones for you.
Okay.
With over 6 million home care worker job openings projected through 2034, how will this shortage impact the actual quality of care families receive?
Yeah, that's a good question. I'd say, first of all, it won't just impact quality. I think it will also impact access as well as cost. In terms of access, and I alluded to this earlier, longer wait times and reduced service is what one can expect. And then, the scarcity also tends to drive up wages, which in turn drive up the cost of care. And we see that reflected in the survey. But you asked specifically about quality. As you might imagine, quality tends to decline. People experience delays in receiving assistance, and fall rates tend to increase. And as you know, falling for elderly people for the age is a serious issue. It can cause serious problems. So when those go up, it's a real problem for the aged and their families. But the net result is that the burden will then shift back to family members, and as we've talked about, that's just not a sustainable solution.
Thank you, Michael. And then Jackie, one of you, I'm assuming this is you, Jackie, because you were throwing out numbers. So one of you mentioned that unpaid family caregivers provide something like almost 900 billion in free help every year. At what point does the high cost of professional care force people to quit their jobs to provide care themselves?
Yeah, I actually think you quoted that number, but I did quote a lot of numbers. So one of the things we focused on is really the hourly rate. But I think if you go online and you look, we actually will tell you what the annual cost is. And if you take the average home care rate and you look at that at I think the number we use is 44 hours per week, home care is more costly than ALC for the same time frame. And I think that's the reality that, Michael, you're talking about, is that families are making a decision on the fact that home care can cost over $70,000 a year, and that may be more than one of the working adults' take-home pay. So they're making a decision on, do I continue to go to work, or do I stay home and take care of my aging loved one? I think it's a challenge, and I think that it's a multifaceted problem that needs everybody involved in the aging and care space to really work together to figure out how to fix it. And I think it's going to take a multifaceted approach to doing that. And there's, Michael, you mentioned, the labor market, but those folks that stay home are now not in the labor market, which isn't adding to Social Security. It becomes a cyclical issue. And that's why I think this is important to raise awareness, but it's also important to understand all the parts of it so we can work together to solve it.
Yeah.
Absolutely. And we're almost at time. And there were some questions around specifics around what we capture in this cost of care survey. And I think this next slide will be pretty helpful to those who have very specific questions. So I wanted to kind of share this exciting update with all of you and for the first time, we have built a simple plug and play iframe that lets you host the CareScout cost of care survey database directly on your website. So if you're curious, you want about specific numbers in your region, zip code, this is a tool for yourself, for your the clients that you're working with, to really support in clarity. So it's a pretty easy plug and play. Apparently, it's easy to set up as well. But if you need support, we're here to support you. This will also be shared with you after today's session in an email. So it'll give you instructions on how to access this iframe. I think, to Jackie's point around, one takeaway is that we need everyone. This is a village to solve this challenge. So every person here is involved. So whether it's related to your care plan, your loved one's care plan, care delivery, we are all in this and we need to come together and really bring this to light, right? And we need to be innovative around that and just keep the conversation going. So as we're tackling our own areas, we do want you to know and remember that CareScout is your source of truth and we want to partner with you to help your families navigate this. At the end of this, so just remember, keep a lookout for your inbox. So we'll send over some resource links, some data benchmarks, a survey to let us know how you like this presentation or didn't like it. And then the iframe, so instructions on the iframe. And the last thing I want to just leave you off with is remember, better planning really does start with better data. So thank you everyone here who joined today. Thank you for what you do. And thanks for spending part of your day with us. And we'll talk with you soon.